This common foot problem could mean your liver is in trouble. Many people dismiss foot issues as merely annoying or unsightly. However, several foot problems can actually be warning signs of an underlying liver condition. One of the most telling is cracked heels, which are often brushed off as dry skin. But persistently cracked heels that don't respond to moisturizer could indicate a problem with your liver function. The liver plays a crucial role in manufacturing collagen, a protein that keeps skin elastic. When the liver isn't working properly, it makes less collagen, resulting in brittle, cracked skin on the feet. Cracked heels may be your liver's way of crying for help. If you can't seem to get rid of cracked heels, get your liver enzymes tested. And pay attention to other subtle signs like fatigue, loss of appetite, or discolored urine. Catching liver problems early is key to preventing long-term damage. Your feet can provide important clues, so don't ignore their distress signals. Asterisk, do you have dark spots on your feet? It could be a sign of liver trouble. Have you noticed any unusual dark patches or spots appearing on your feet lately? These seemingly harmless spots may actually be a sign of liver trouble brewing beneath the surface. Dark spots on the feet are often caused by extra melanin production. Melanin is the pigment that gives skin its color, and it protects against sun damage. An overload of melanin leads to discoloration. The liver helps regulate melanin production and elimination. So when dark spots pop up suddenly on the feet, it may indicate impaired liver function. Specifically, a buildup of waste products that the liver can't process efficiently. Other symptoms of a struggling liver include yellowing eyes or skin, abdominal pain, chronic fatigue, and blood in the stool or urine. If you spot dark patches on your feet, get your liver enzymes tested right away. Addressing any problems early can help prevent liver damage down the road. Your feet are trying to tell you something important, so listen up. Asterisk, foot odor out of nowhere? It could be your liver. Have you noticed a sudden increase in foot odor lately even when wearing clean socks and shoes? The cause may be an overburdened liver. The liver is responsible for eliminating toxins from the body. When it falls behind, toxins can build up and come out through the sweat glands in the feet. This results in a strong, unpleasant foot odor. Some other signs of a stressed liver include nausea, chronic fatigue, jaundiced skin, and weight gain. The liver is a powerhouse organ, performing over 500 vital functions. So when it's overworked and unable to keep up, our health suffers in many ways. If you're plagued by stinky feet no matter what you do, get your liver enzymes tested. Eliminating the underlying cause of liver dysfunction is key to banishing foot odor. Help your poor liver out by staying hydrated, eating clean, and limiting alcohol intake. Your feet and liver will thank you. Asterisk, bunions getting bigger? Your liver may be to blame. Have those pesky bunions on your feet been getting bigger lately? The cause might be hiding in your liver. Bunions form when the joint that connects the big toe to the foot gradually becomes misaligned. Heredity, arthritis, and wearing tight shoes can all contribute to bunions. However, one overlooked factor is impaired liver function. The liver processes nutrients and produces compounds that form bone, cartilage, and other structural tissues. When the liver isn't working at full capacity, these processes suffer. Other signs of a sluggish liver are skin and eye discoloration, chronic fatigue, and cognitive issues like brain fog. Pay attention to your bunion size. If they are rapidly enlarging, get your liver checked out. Addressing the root cause can help shrink painful bunions and restore balance to your body. Asterisk, mysterious foot pain? It might be a warning sign of fatty liver disease. Have you been experiencing aches and pains in your feet for no apparent reason? One surprising potential culprit is fatty liver disease. Fatty liver occurs when too much fat accumulates in the liver cells, causing inflammation that hampers liver function. This prevents the liver from effectively filtering toxins, which then build up throughout the body, including in the feet. Toxins irritate nerves and tissues, leading to tender, sensitive feet. The pain tends to be diffuse, occurring along the arches and heels rather than in specific spots. Tingling or numbness in the feet can also occur. Other symptoms of fatty liver disease include fatigue, abdominal discomfort, nausea, and weight loss. The condition is most common in those with obesity, diabetes, or high cholesterol. If you're noticing mysterious foot pain, get tested for fatty liver so you can address it before it progresses. Your feet are sending you important signals to take care of your liver health. Swelling or inflammation in the feet. Your liver may be congested. Have you noticed swelling, redness, or inflammation in your feet and ankles lately? These are telltale signs of a congested liver. The liver processes nutrients and toxins from the blood. When the liver is overwhelmed and operating sluggishly, these substances can back up into the bloodstream. This causes inflammation that often manifests in the feet and ankles where blood pools. Other signs of a congested liver include nausea, chronic fatigue, high blood pressure, and weight gain. The swelling may come and go but tends to be worse at the end of the day when the liver is most fatigued. Liver congestion has numerous causes including fatty liver disease, hepatitis, cirrhosis, and alcohol abuse. The solution is to identify and address the root cause. With treatment, the liver can be restored to full functioning and the swelling reduced. Don't ignore puffy feet. See your doctor to rule out liver troubles. Your feet hold vital clues. Tingling feet all the time? It could point to liver trouble. Have your feet been plagued by a constant tingling, prickling sensation lately? Annoying tingling feet may actually be a sign of liver dysfunction. The liver filters waste and toxins from the bloodstream. When it becomes overwhelmed, these substances accumulate instead of being eliminated. Toxins like ammonia can damage nerve fibers, producing tingling and other abnormal sensations. The tingling usually starts gradually in the toes and soles. It typically comes and goes but tends to be more bothersome at night or when feet are elevated. Other symptoms of a stressed liver are jaundice, abdominal swelling, nausea, and fatigue. Poor liver function has many causes including viral hepatitis, fatty liver disease, and liver tumors. Getting the right treatment can help clear toxins, repair damage, and resolve that aggravating tingling. So if your feet seem to have a buzzing life of their own, get your liver checked out fast. Don't overlook your feet's distress signals. Are your feet always freezing? It could be a sign of liver trouble. Do your feet feel constantly icy cold no matter what you do? This annoying problem may point to an underlying liver issue. Poor circulation is often to blame when feet feel chronically frozen. Proper blood flow relies partly on the liver making adequate albumin and clotting factors. When liver function falters, circulation slows, leaving feet frigid. Liver disease also causes nutrient deficiencies and anemia, which reduces oxygen delivery. Nerve damage from liver-related toxins can constrict blood vessels too. The end result is feet that feel like blocks of ice. Along with frosty feet, symptoms of liver problems include jaundice, nausea, abdominal pain, and itching skin. Treating the liver condition itself will get to the root of the circulation troubles and help warm those feet up. Don't just reach for thicker socks. See your doctor if your feet are always freezing. Are the soles of your feet yellow? Your liver could be to blame. Have you noticed an unusual yellowish discoloration on the soles of your feet? This seemingly harmless issue may actually stem from an underlying liver disorder. The soles turning yellowish can be caused by carotenemia, a buildup in the blood of a yellow pigment called carotene. Carotene is found naturally in many fruits and vegetables. Normally, the liver converts carotene into vitamin A, but when the liver is damaged and not functioning properly, carotene can accumulate and disperse throughout tissues. The bottoms of the feet are especially prone to showing this yellow hue. Other symptoms of a struggling liver are jaundice, abdominal swelling, nausea, and insomnia. If you spot a yellow flag on your feet's soles, get your liver function tested promptly. Identifying and addressing any problems quickly can help restore healthy color and a healthy liver. Don't ignore your feet's inside information. Are the veins in your feet more visible? It may signal liver issues. Have the veins in your feet been looking extra prominent and visible lately? This seemingly superficial symptom could potentially point to an underlying liver problem. The liver makes proteins that help hold blood inside veins and keep vessels firm. When liver function declines, vessels can lose structural integrity. This causes them to enlarge and appear more obvious through the skin. In addition, poor liver performance allows toxins to accumulate in the blood rather than flushing them out. This thickens blood and further engorges feet veins, making them bulge and wind more visibly. Along with pronounced foot veins, other signs of liver trouble include skin itching, chronic fatigue, and abdominal fluid buildup. If your feet's roadmap of veins suddenly looks more prominent, get evaluated for liver health. The sooner any issues are caught, the better the outcome. Your feet provide invaluable clues, so heed their messages.